Audrey, thank you very much indeed for coming back. You've had treatment for breast cancer. The treatment cycle has now finished, I believe, about 5 weeks ago.
Yes,
How are you?
I'm good. I'm very good. Very positive. I it was a rough 6 months. The first 3 months, the drugs I was on caused a lot of nausea, and that was very intense and draining. I was lethargic. I was tired a lot. The second cycle, which would have been 12-week cycles, it was more joint pain. So it was for me, it was more manageable than the actual nausea. I found that very challenging. But I am doing good now. The first week after treatment, I was quite tired, very fatigued, but I'm coming around now and my energy's coming up every week, improving.
That is really good to hear. And of course, we wish you all the very best in the future.
Thank you.
You and I have been talking just before the interview and wondering quite what to talk about. And one of the things that came up was remembering, of course, that this is to help healthcare students, medical students, nursing students, pharmacy students, therapy students, how best to communicate with you, to see you through what has been a pretty strong 6 months for you. And we've talked a bit about your cancer journey and the treatment in the first two interviews. Over the last 6 months, there must have been some things that you felt were fantastic, some things that were done really well, or people who dealt with you as well as the illness, the cancer. What were the good bits?
I suppose the good bits were my oncologist. I always praise him and his registrar. They've been fantastic, very approachable, very much concerned about how I'm getting on. I can call them and they'll always contact me straight away if I've any anxieties or any concerns about anything. They've been fantastic on the journey. The nurses in the oncology unit, when I'm in the day centre, they've been great. I can pick up the phone and ring them at any time. They've been very helpful. But funnily enough, it's the other patients that I get a lot out of when I'm in treatment, like their side effects. And I might be a week ahead of one person and I'll come in and I'll say, oh, my nails are starting to lift. It could be something like my nails are going brown, they're starting to lift. That person won't experience that, but then she'll come in with the same complaint the next week. Somebody's a week ahead in the journey and they're kind of advising you what could be coming next. So I got a lot of my knowledge from the actual patients themselves when we're sitting around for hours on end discussing it, which is, I know that's unusual, but, well, it's not unusual, but I got more, I suppose, from the other patients than I did from anybody else because you've so much time with them.
And of course, they have got first-hand experience.
Exactly.
Yep.
We're all in it together.
Yep.
Yeah.
Now, from the power of the patient, the knowledge of the individual going through the treatment over the years, that has created support groups and charities. Have you come across any of those charitable organisations, any charities that support women with breast cancer?
There is a support group in Cork, and I haven't been there. I went in 2010, and they are amazing. It's all voluntary. They're very, very good there, and they have a specialist breast care nurse there. But I found for me in 2010, it was a much older group of ladies that were there. And I suppose for me, I found it a little hard because I was the youngest in the group. Now, things might have changed since, but I haven't been back there. But they are based in the city and they are fantastic. But I could see it being an issue for, we'll say, maybe an older person, an older lady
Yeah.
who's not driving. They may not be mobile. it's not available for everybody. It's not
So it's
suitable
very
for
good
everybody.
for some,
For some,
but
if you
not
can
for all.
travel.
Yes.
If you can
Yes.
travel. For some people that won't work. There isn't really local support groups in towns and
Okay.
communities. I
Okay.
just came across one in the city.
Okay. This group of people that you met during treatment, are you still in touch with some of them?
Yes. Yeah, we have each other's numbers.
Yeah. And has a friendship, a support developed with that smaller group of people?
Yes, definitely.
Yes. Yeah.
And even discussing, like for me, my surgery was before my treatment, before my chemotherapy. But for a lot of the ladies, it's afterwards. So we had a lot of discussions on, they had the decision of lumpectomies, mastectomies. We all chatted through it and just, gave input to each other, just kind of food for thought really to go
Yes.
home and have a think about it. But we support each other in that way, and we've been in touch. They've all had their surgery since, so we've all been in touch with each other, see how everybody's doing.
Good. What else has been helpful for you?
Counselling. I went back to my counsellor after I finished treatment. I didn't feel I could go back during it because the treatment takes so much out of you physically. So to deal with the psychological issues would have been too draining all at the same time. So I returned the week after I finished, and that has been, for me, that has been the most positive tool to move forward in my recovery.
Is this the same counsellor that you met for the first diagnosis?
Yes, in 2010.
So it, I guess, has helped talking to somebody who understands your story.
Yes, she
Yes.
knows me. She knows
Yes.
me well.
Yes.
It has definitely helped to go back to the same counsellor. She is amazing, and I trust her,
Yes.
and she knows me, so it makes it
Yes.
easier.
You sound very positive.
I am very positive. I think, well, I've been told by my counsellor that I'm very resilient and I'm forward thinking, and I am. Like, as soon as I finished, I wanted to get back in to the counselling and start dealing with the head stuff so I could move on from it. Now I've been going weekly since, and I'm doing very well. And I'm setting goals in the future, returning to college in September. I return to work this week, part-time, just starting with a few
Yes.
hours.
Yes.
And it's all helping me move forward. But I did speak to her after one of our sessions, and I said that I can't understand how somebody could go through treatment and come out the other side without counselling, because you finish your treatment, and I think that is where the danger zone, as I call it, kicks in. You the safety net is gone. You finished the active treatment, and you're on your own basically. Yes, you've got your checkups, your medical checkups, but that's where I think the irrational mind, maybe, and the emotional mind kicks in, and the fears kick in of reoccurrence and everything like that. And I think that is when you need the support nearly most, because the control, it's been out of your control while you're going through the physical treatment, but you need to take control back of your life then.
Okay. Thank you. So really, we're talking about something called survivorship.
Yes.
That you've finished the treatment, you've been through the scientific, physical, we are going to do this and this and this and this. You've had great support from the oncologist and from his registrar. You've had great support from the breast care nurses. But now that you've finished treatment, is there regular follow-up for you, or is it something that you feel you've got to try and manufacture yourself?
Well, my follow-up is just with the oncologist. My next appointment now is in 3 months, but nobody ever spoke to me about extra support or resources that might be available. Like, something I found would be really helpful would be, for me, I think it was a touch of health anxiety I got. where do I go with diet, exercise, what do I do to help my well-being and physically make myself as fit and healthy as I can be. But nobody has ever suggested speaking to a dietitian, a nutritionist, anything like that, which I think would be great. Like that, a survivorship program where when you finish treatment, you've other resources to help you move along on your journey, be it if people had financial difficulties, to speak to somebody in that line. But I think definitely a health program would be really advantageous.
Okay, a health program. Where would you feel that should be available? Should it be at the hospital? Should it be with groups of people who've been through it? Should it be in general practice or the public health nurse or?
I think it could be organised or arranged through the hospital. It should be a follow-on step. It doesn't necessarily have to be in the hospital. People don't want to be in and out of the hospital. They've had enough time in there. If it could be done as maybe a support group like that through a district nurse, something like that.
Or essentially as a community support.
Yes.
Somehow.
Yes,
Yeah.
I haven't really thought it through, but if there was something more local and more accessible for most people, but as an automatic follow-on that's available to people if
Right.
they wish to have it.
Okay, thank you. Seeing you looking so well, I do hope that everything has gone very successfully.
Yes.
But I guess as well, there have been one or two occasions where people have put their foot in it a bit, or perhaps have said things that have come out wrong, or said things to you that didn't make sense. Any words of caution to the next generation?
I think pity is the worst thing you can, when people pity you, when you finished, when you've got a diagnosis like I have. Some people, they probably don't mean it, but it's off-putting. When you're trying to move forward, you're trying to be positive, look ahead, not look back, and you want to have a good positive outlook that you can see yourself around in 20, 30, 40 years. You don't need the pity party. So I just think be sensitive of that, be positive around a person. But then there is times where you are just having a bad day and you just want to sit with it and say, this is crap, this is hard. And you don't want a person, how do I explain it? When someone's, oh, you'll be fine, you're fine now, it's over, move on. They mean well, but sometimes you just need to sit with whatever mood you're with at the day. So I just think if a person is there to listen, let them listen, be present, but let you have whatever feeling you have on that day. You'll move through it on your own. But pity, no pity.
Okay, so how do our young doctors and nurses and pharmacists, healthcare professionals, how do we communicate with you without giving too much pity, but giving more support and sympathy? What sorts of things do we avoid saying?
You see, I have not experienced pity from the medical professionals, really. They acknowledge it's a difficult time, but I haven't experienced pity from anybody I've been dealing with.
Because they see it as a path and they see it looking towards the future.
Yes.
Yeah.
Yes.
Okay.
Really, they
Okay.
do. In my, you see, everybody's case is different, but I caught my cancer very early. It's been removed. The chemotherapy was preventative, so I must have a positive outlook. I have had times where I have got anxious. One thing I noticed was I was 2 weeks finished my chemotherapy, and I happened to be at home one evening lying in bed, and I just rested my hand on my breastbone, and I thought it felt a little tender, and I suppose it felt a little different because I've been post-surgery. I haven't really been touching that area because of the fear. I have a fear of what I might find if I touch that area. And I did get myself quite worked up that night, and I didn't sleep. I was convinced there was something wrong, and I rang my oncologist registrar the next morning. I left a voicemail. She came back to me very quickly, and I explained where I was at. And she calmed me down. She told me, you've had your treatment, you've had it removed. You know, you're going to have these health anxieties. They're going to come up. But she didn't want to bring me in and give me scans straight away. She said, I can't have you panicking at every little symptom and side effect you're going to have. But what I thought might be beneficial for people going through breast cancer treatment is after your surgery, when things do feel different, the tissue is gone and you're feeling, it just all feels very different, to maybe take you back in to a breast care nurse and have that initial examination with a nurse where you do it together and you know what's normal, you know what your norm is then before you get yourself worked up, and it's a safe environment to do it in when you're actually with the professional who knows what should be and what shouldn't be. I thought that might be beneficial for
That would be a very good idea.
Yeah.
Yes, yes. So, for 6 months, you've been the woman with breast cancer. For 6 months, you've been the woman who's been having cancer treatment. How do healthcare professionals remember that there's that person with a condition rather than the condition sitting in the chair? How do we see you?
Well, just like that, as a person. I'm a person, I'm not a patient. I think treatment, I think dealing with people who've going through a diagnosis, it has to be person-centred and not cancer-centred.
Easy to say. And all the textbooks tell us to do this. And Audrey, you're quite right. But how do we do it?
I think you need to, like, I know the time people, when you go to see the oncologist, they don't have the time to give you, they've a busy day, they're meeting a lot of people who are all in a crisis stage like myself, but you need to just give a person time, ask the questions. I know they have their job to get on with and it's more medical, but I do think by just referring somebody on to speak to somebody afterwards about possibly, like, you're getting information, it's very complex, you're in a crisis stage, everything is going over your head, just to refer you on, if there was maybe even 2 days later when you get news, to maybe go home, sit with it, come up with questions. You're going to have a lot of questions, you're going to have anxieties, but speak to somebody, a next step, to speak to somebody who can talk with you about your actual feelings, your thoughts, and where your head is at.
As you know, I'm a GP, and so over the years I've had a lot of people come in almost apologetic, saying, don't want to bother you, doctor, but my son, my daughter, my mum, my dad has just been diagnosed with cancer and I'm falling apart. How do we help the family? Was it easy to tell your family about the diagnosis?
No, that was the hardest thing. I found getting the news myself was hard, but having to go home and tell my family was the hardest. And there isn't support for the family. You meet the oncologist, you meet the team. Nobody speaks to your family. They would have to go to their own GP or get their own help, but there isn't really support available, I believe. Not that I've come across, for the person's family who are going through it. And it's, in some ways, it's harder for them because they have no control whatsoever. You are making the journey. You were going through the treatment. You were going through the surgery. I think they feel they have no control over what they can do to help, and it's hard. Sorry, but I think it's most challenging for family, because they love you and they can support you, but they're not going to share their concerns with you. That's the last thing. I have never seen any of my family upset around me. negative around me. They're constantly positive, constantly looking forward. But they need somebody for them. And that's important.
It seems to me that you're almost more worried about your family than you are about you. So I know that you must have had a lot of support, but I guess from certain people, from certain well-chosen people who you would trust. So where did you find that support was easiest to go to?
Within
Well, was it your mum? Was it your best friend? Was it the next door neighbour?
friends.
Friends? Yeah.
And I'm very close to my friends. And it's hard for them too, but I can speak to them. They're a group. They can speak with each other when I'm not there, and they can discuss it amongst themselves. And I don't know what's come up in those conversations, but I feel I can speak to them and not worry as much about my friends as I worry about them too. I know they've had it hard. They've seen me going through it, and they've been amazing support. They've taken time out of their weeks. They came up with a schedule, and somebody took me to different treatments every week so my family would not have to. I didn't want my parents to have to go to the hospital and sit through chemotherapy and seeing me there for 5 hours at a time. So my friends brought me weekly or every 3 weeks whenever I needed it, and they were instrumental in my recovery. They were amazing. But yeah.
Can I ask you something? And please, if it's too difficult, don't. We'll scrub it.
No.
I bet your mum and dad wanted to come with you to the hospital.
Yes. They did.
I know if I was your dad, I would volunteer.
Oh, of course, they volunteered. Yeah.
How did you stop them going with you?
I just told them that people had booked time off work, and they had taken the day off. So it would be unfair for me to turn around and say, "Oh, actually, Mum is taking me or Dad is taking me." I skirted around it.
And I know you love your mum and dad very, very much indeed, but in general terms, why was it that you felt that it was so much easier to have a friend or two with you rather than family? Was it to try and prevent the hurt to family?
Definitely. To prevent the hurt to family was the main reason, but I suppose I would have found it added pressure as well in there if I was feeling unwell. On the first drugs I was on, within 20 minutes of getting the drug, I started feeling nauseous and sleepy, and I would get anxious as the weeks went on because I knew exactly what the last time was like, and I knew I had it ahead of me for another week. So I had to put on a brave front in front of my family. I felt I had to. And I had enough to deal with, so it was easier to just do it on my own.
Okay, 5 weeks after treatment finished.
Yes.
I guess the communication with your mum and dad has increased since the treatment finished. Have they given you any description, any indication about what help or how they managed through this difficult time?
No. To be honest, we haven't really discussed it at all. I've moved on. We discuss when my next appointment is.
Yeah.
My mum asks, "Will we bring you?" I said, "No, I can drive myself. I'm fine." I'm very independent when I go to the hospital now. I'm able to drive. I couldn't on the drugs I was on going to chemotherapy, but I go to the appointments on my own. Now, my next checkup, my annual checkup, I will take somebody with me, but it won't be my mum because I just can't deal with worrying about them when I'm trying to deal with the worry and the anxiety that'll come around those appointments that are scary.
And I think that's a very sensible approach. So if any parents watch this, I think that would be very helpful.
Yes.
Audrey, it is inspiring to talk to you, because how you are taking things forward, how you've dealt with the treatment, and how you are in control and gaining more control of yourself and your life. But you did talk at the beginning that, in a way, to start with, you were in, I think your lovely phrase was, a cancer bubble.
Mm.
And certainly some people find that cancer bubble to be very difficult to get out of. Of course, everybody knows that you're in it for a while. You can't help that. How do we help, we as the human race, really, how do we help people see beyond the cancer bubble?
I think when you're speaking to a patient or a person who's going through treatment, just be forward thinking. Speak to them about plans for the future, setting goals. Ask them about where they're at in their head. I've been lucky in that I am resilient and I'm moving forward on my own through the help of a counsellor. But some people, they find it hard to move on. If you, for example, are predisposed to anxiety and stress before you have a treatment, that's going to be very challenging to move forward and have a positive outlook. But I think you need to set goals for yourself. I think for me, the way I look at it now is, you've one life, you need to get on with it. I can spend all my time worrying about a reoccurrence, but that's only wasting my time. It's getting me nowhere. If God forbid it ever comes back, it's coming back anyway. I can do something for my own mental health. I can get myself physically fit. I've put on quite a lot of weight from steroids and drugs over 6 months being inactive. I think something like a health program, something like that for people would be really beneficial. Get them control back in their lives, for them to take control back again from the hospitals, from the medical professionals, and start looking after their own health. And I think if you're in a good if you're physically feeling good, and if you're doing all you can to help yourself with diet and exercise, you can't do any more than that. And stress, I think you have to avoid stress. Stress is big. I just think to look after yourself, do things you enjoy, have a good quality of life, and that all starts with just maybe I feel speaking to somebody, be it life coaching. I've never had life coaching or counselling, something like that, just to get the ball rolling. But like that, I think it would be great if it was a follow-up from the hospital where you're given that information, and maybe just to assess somebody's mental health when they're going through treatment. Nobody's ever asked me if I've ever suffered from mental illness of any kind. I suppose I go to my treatments, I'm always fairly upbeat, fairly positive, but nobody's ever asked me my sleep pattern, how I'm getting on. I did go through a period of waking at 4 a.m. All my thoughts were very negative. This was just when treatment was coming to an end, that point where I think is really critical to looking after somebody mentally. And I was waking early in the morning, very negative thoughts, very irrational thinking, and I might have those thoughts from 4 right up to 7 in the morning, and by the time I should be getting out of bed, I was absolutely exhausted because I'd mentally been beating myself up with all this. So nobody has ever asked me, how are you sleeping, which would be a warning sign that maybe there's something going on, that you need to speak to somebody. So I think something like that would really benefit to get to the first step, and then in taking control back.
And that's where pity should be discouraged as well, because
yes,
if you're in the cancer bubble, if you're feeling terribly sorry for yourself and can't see the way through, and other people are pitying, then it holds you back, doesn't it?
And some people could feed off the pity.
Yes.
You know, a patient could feed off the pity if that's where they're at. So I think you need to try and move somebody forward. A counsellor will do that. You can only listen to a person in that bubble for so long, but at some point you need to be a bit progressive and move them forward a little, and it can be done in a safe environment with counselling.
So, yes, that there is this power imbalance in a consultation.
Yes.
The professional, usually the doctor, knows best, and you have to do as you're told.
Mm-hmm.
Why is it that some people find it difficult to stick their hand up and say, actually, I'm not sure that's the right thing for me?
I think if the doctor is open to a discussion and they're open for it, and you can be assertive and proactive, you need, for shared decision making, you do need to be comfortable being assertive and being proactive in your treatment. Understandably, the doctor, they have all the medical knowledge, but it needs to be a decision made for the patient, with the patient, because at the end of the day, the old school way of doctor knows best and a patient is just told to get on with treatment and comply with it even if they don't understand what's actually being done. I think that's not really going to help the person going through the treatment. They need involvement in it. They'll be more confident if they agree with the decisions and if it's discussed without this balance of power, that old way. I suppose I find myself sometimes going, and I'm very aware that the time constraints they're under, and I do find I'm a bit of a nuisance. Oh, I'm sorry now, I know you're busy. You're making excuses. I think sometimes if you look at the medical professional, like look at yourself as a client maybe instead of a patient. You're there for a service, and why should you feel you're beneath this person? You know, it needs to be on an equal level. Par.
Thank you. The difficulty is that not everybody is as resilient and as assertive as you are.
Mm-hmm.
How do doctors and nurses and other healthcare professionals, what sort of encouragement can they give, even in a very busy, very time-limited consultation? What sorts of things should they be saying to the patient to encourage the patient to tell their views?
Just be open, be friendly. Ask the patient what they would like the outcome to be of their treatment. It's not just about the outcome when treatment is finished, but like I suppose regarding breast cancer, what surgery, lumpectomies, mastectomies, going through both options, giving the person giving them the choice to decide what will suit them best.
And to get agreement. So if there has been a discussion saying, I would suggest this, what do you think? Do you agree with that, or
Yes.
do you have a concern?
Exactly. Open conversation. You give, maybe this is the route you'd like to go down, see what they think. Would they agree? Would they disagree? Can it be tweaked? Things like that. I think just where the patient isn't looked at as difficult if they're being assertive and they're asking questions. That those days have to go. It has to be more about shared decision making, and that is very important in a person's treatment and down the road in their recovery. They trust the doctor, where they can trust them, be open, and it's open conversation. That's key.
Thank you.